40, headed to North Central Bronx for the code red.
Has she been out of the home in the last 2 weeks?
Screening positive.
Is she able to speak in full sentences?
303 good.
Where are you responding?
We're used to death. No, not to sound callous or anything like that, but we're a lot more used to death than the average person. We see it. We're there for some of these people's worst moments in their lives. But mentally, because it doesn't happen constantly, one after the other, you have time to kind of recover and deal with it however, you deal with it. Now, since it's so many, it's disheartening. You feel like you can't do anything. So this patient, when we were screening the call, we told them, when they were asking the questions, the patient said they were stable. And if we can, we try to get them outside so we can limit contact with other people in the home and the environment. How long has this been going on?
I went to the doctor on Tuesday.
Okay. So this is going to go in your nose, around your ears. This little thing right here is going to sit right in front of your mouth, and it's going to tell me how your lungs are doing, okay? We train for infectious diseases, and we train for mass casualty incidents, which is a large number of patients overwhelming the system. Typically, you don't have both. 303, 10-8, code 7. They'll give you their signal shortly. You're going to have a 14I. You're going to need decon after.
7-4.
His oxygen level is a little low. So typically your normal oxygen level is between 95 and 100. His was 78. The scariest part about this disease is typically somebody who's that low, they'd be blue. We're not seeing that anymore. We hear people complaining about staying at home and, I have to deal with my family this whole time, or I have to do this. Like, I don't get to see my family at all. There's EMTs, there's paramedics, there's nurses, there's doctors, the true frontliners in this pandemic that are sleeping in hotels, sleeping in cars, because they're worried about bringing it home to their family, and people can't stay in their home to stop this.
Paramedic 5-1. Came in third-party caller who left the scene unable to screen at this time. 11 Apple 10-4.
Out on Mount Carmel, just confirm the numeric.
17, going to be on the second floor.
¿Tiene asma o COPD? ¿Tiene problemas medicamentos, alta presión, diabetes? No. ¿No? ¿Toma pastilla o no? His oxygen level is way too low.
Does he have, he's corona positive,
Tengo
right?
todavía mucho. Positiva coronavirus? Because we've been so busy and we've had so many hyperacute or super sick patients, they all just meld together into one big bad call.
A little better? Thank you. A little better? Un poquito?
Mantengo los pies ahí, mantenga los brazos adentro.
Okay.
This changed everything for us. So we did a month's worth of cardiac arrests in a 24-hour period. We did 4 months worth of intubations in a 24-hour period. If people saw some of the things that we see on a daily basis, they wouldn't want to go outside. They would follow those social distancing rules. It takes its toll on you, no matter how strong somebody says they are or how okay with death that someone says they are. You're still a human at the end of the day, and we all feel it. Nobody gets into EMS for the money. We do it for our patients. Is this right here? slowing down is hard because it gives you time to think. We've all seen, especially lately, a lot of death, a lot of super sick patients that our mind necessarily hasn't had time to fully process. I wonder how it's going to be for all of us once it goes back to what's going to be the new normal. How are our EMTs, our paramedics, our nurses, our doctors, our hospital staff, the morgue technicians, the funeral directors who have dealt with so much death, more than anybody should ever deal with. How are we going to be after all this?